Hello everyone, welcome back to E.L.V.A Nursing YouTube channel. My name is Esther Filippo Idile and I'm so happy to have you here with me today. So today we're going to be talking about parathyroid. We're still in the endocrine system disorders. You can check the playlist on endocrine system disorders. Also make sure that you subscribe to this channel. Please share, like, drop a comment. Thank you. All right, so now let's dive right into the parathyroid hormone. The parathyroid gland is behind the thyroid gland. All right, so the thyroid gland, if we go back to this picture real quick, so this is pretty much what the thyroid gland looks like. And you see those green dots on it, that's the parathyroid. It's actually at the back of it. All right, so those four dots, those are your parathyroid glands. And what do? They secrete your parathyroid hormone. Now, what does your parathyroid hormone do? What it does is that it increases the amount of calcium that you have in your blood. So it is pretty much responsible to help making sure that your calcium level and production is on point. All right. It's opposite of what your calcitonin does. Your calcitonin is secreted by the thyroid gland. It does opposite of what a parathyroid hormone does, which is that it decreases calcium level. But your PTH, which is your parathyroid, which is what we're focusing on today, that one increases your calcium level in the system. Now, we're going to look at both extremes that we can have. We can have hyperparathyroidism or hypoparathyroidism. Hyper, you're producing way too much, all right, of parathyroid, aka PTH, and with hyperparathyroidism, you're producing too little of parathyroid. All right. Now, remember, I told you that your parathyroid hormone help you with the production of calcium. So, which is why if someone has hyperparathyroidism, they end up having too much calcium in their system, aka hypercalcemia. The opposite of it, if someone has hypoparathyroidism, they're not producing enough calcium, so they end up having little calcium level, aka hypocalcemia. So we're going to look at some clinical manifestation of both. With hyperparathyroidism, we have hypercalcemia, like I said, but then we also have hypophosphatemia. Why? Because naturally, your calcium and your phosphorus, they have what we call an inverse relationship. When one is high, the other one is low. So in this case, whereby we have a high calcium level, that means we're definitely going to have a low phosphorus level. We also have skeletal pain, pathological fractures, kidney stones. All right, when you have too much calcium levels like that, they can start to crystallize and come together and cause stones in the kidney. It can also cause fatigue, weakness, drowsiness, and dyslipidemias, which are abnormal rhythms of the heart. If we go to the other side, which is hyperparathyroidism, this time we have hypocalcemia. That means we're going to have hypophosphatemia. Good. When your calcium level is low, one of the biggest, most deadly symptom that you can have is a laryngeal spasm. So your larynx is your voice box. When you breathe in air, it passes through your nose, down your throat, passes through your larynx, then it entered into your trachea, which then goes into your lungs. But if you have a laryngeal spasm whereby it closes, the air that comes through your nose is not going to be able to pass through and enter into your trachea and then your lungs. So with laryngeal issue, we're gonna have an upper airway distress. So that's one of the biggest complication or clinical manifestations we can have with someone who has a hypoparathyroidism. So we really gotta watch for that. Muscle spasm, chivastic sign is a type of tetany. So if you touch the patient's cheek, they have the facial spasm. All right, so that's chivastic sign. The other one is Straussier sign. Apologies, I didn't spell it fully. Interesting. It's Straussier sign. It's you put a blood pressure curve on the patient's arm, and they kind of have that carpal spasm, and also they might have cyanosis going on. How do we manage this? Whenever we're looking at endocrine system disorders, when you have too much of something, we treat it by removing. And when you have too little, we treat it by giving you what you don't have. So with hyperparathyroidism, that is too much. We're going to treat by removing. So the doctor might end up removing any abnormal tissue, of the parathyroid, or we can take out some of the parathyroid gland. Remember, there's four of them. So the doctor might decide to take out two or three of them to reduce that production, or if there's a tumor or a growth that is causing it to secrete too much, they will take that out. Parathyroidism, on the other hand, is you don't have enough parathyroid. So we're gonna give you what you're lacking is calcium. All right. So we're gonna give IV calcium gluconate or calcium chloride. Whenever you're giving calcium via IV, you want to give it slow because it tends to irritate the blood vessels. And also, your patient might complain of a hot feeling on their skin or their tongue. You want to let them know that this is normal, so there's nothing to worry about. And also, when you're giving calcium, you gotta give vitamin D because vitamin D helps with the absorption of calcium, right? And also, we can give calcitrol. So the doctor might prescribe calcitrol for the patient to take home because it's an oral calcium medication. Patient also need to increase their foods in calcium. All right. Finally, we're going to look at some nursing interventions of hyperparathyroidism and hypoparathyroidism. This patient might need diuretics, your hyperparathyroidism patient, to help flush out excessive calcium in their blood from their blood. Also, because they might develop kidney stones, aka kidney calculi or renal calculi, whenever they urinate, you might want to strain it. So you can strain out all that stone, and the doctor might want you to send it to the lab. A low calcium diet because they already have way too much calcium in their system, and they need to avoid antacids, aka Toms, especially because it's made of calcium. All right. Now, if the patient goes through a procedure and they take out some of their parathyroids and now they have a low calcium level, you want to watch for that. You want to watch for signs of hypocalcemia, such as tetany, chivastic sign, Trozier sign, cardiac dysrhythmias, carpopediospasms, and we would treat by giving them calcium gluconate. All right. On the other hand, for hyperparathyroidism, because now we're treating them with calcium, they might end up taking too much of it. So you want to watch for signs of hypercalcemia. All right, such as vomiting, disorientation, anorexia, abdominal pain, and weakness. And also remember that this patient who has hypoparathyroidism has low calcium, but they have high phosphorus. So you need their food to be low in phosphorus because they already have a high phosphorus level. All right. So that is it with your parathyroid hormones. And we have hyperparathyroidism, aka hypercalcemia, too much calcium production, and hyperparathyroidism, aka hypocalcemia, due to low parathyroid hormones, aka low calcium production. So I really hope this was helpful. Please make sure you subscribe, hit that like button, drop a comment, and please make sure you share this to your fellow nursing students or someone you know who will need it. And I will see you on the next video. And if you have any topic that you would like me to talk about, please drop it in the comment section or you can send me an email. And I'll see you on the next one. God bless you. Bye bye.